Ever wondered how to manage inflammation effectively? Or maybe you're unsure about the different anti-inflammatory medications out there. Today we'll clear the air for you. Inflammation, while a natural bodily response, can sometimes become a problem when it's chronic or excessive. That's where anti-inflammatory medications come into the picture. They help manage and reduce this inflammation, aiding your body in its healing process. There are two main categories of these medications. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs and corticosteroids. Each of these has its unique way of tackling inflammation, and understanding them can help you make informed decisions about your health. However, these medications should always be used under the guidance of a healthcare professional, as they can have side effects, especially with long-term use. So, let's dive into these two categories of anti-inflammatory medications to get a better understanding. First up, we have non-steroidal anti-inflammatory drugs, or NSAIDs for short. These include common names you may recognize like ibuprofen or aspirin. NSAIDs are a class of medications that work by reducing inflammation, pain, and fever. They achieve this by inhibiting the production of certain chemicals in the body that cause inflammation. Examples of over-the-counter NSAIDs are ibuprofen, which you might know as Advil or Motrin, naproxen or Aleve as it's often branded, and good old aspirin, sometimes labeled as Bayer. For mild to moderate pain and inflammation, the dosage instructions on the package, or as prescribed by a doctor, should be followed. Now here's an important tip: always take your NSAIDs with food or milk. This can help reduce the risk of gastrointestinal side effects. And speaking of risks, it's crucial to avoid long-term use of these medications without medical supervision. This is because they can lead to gastrointestinal bleeding, kidney damage, and even increase heart risk. Remember, while NSAIDs are effective, they should always be used responsibly and under professional supervision. Next, we have corticosteroids like prednisone and cortisone. These are another type of anti-inflammatory medication. They play a pivotal role in managing inflammation, particularly when speed is of essence or for chronic conditions. Corticosteroids come with their own instruction manual. They might be prescribed for short-term use in high doses to rapidly control inflammation, or for long-term use at the lowest possible dose to manage ongoing conditions. It's crucial to adhere to the doctor's instructions to a T, as the dosage varies significantly based on the condition being treated. One important note is to never stop taking corticosteroids abruptly without medical advice. Gradual tapering is necessary to avoid withdrawal symptoms. As with NSAIDs, corticosteroids should be taken under the guidance of a healthcare provider. Whether you're using NSAIDs or corticosteroids, there are a few key things to remember. Always consult a healthcare provider before starting any new medication. It's crucial to understand potential side effects and how to manage them. Don't forget to inform your doctor about all other medications you're currently taking to avoid adverse interactions. Consider the benefits of lifestyle changes and natural anti-inflammatory supplements such as omega-3 fatty acids and turmeric. These can also play a significant role in reducing inflammation. Remember, the best medication for managing inflammation can vary based on an individual's health profile and specific cause of inflammation. Consult with a healthcare provider to find the best approach for you. Like, share, and subscribe.